Hello and welcome to the cardiac surgery patient journey at the Golden Jubilee National Hospital. We understand that for many of you, having an operation is a new experience, especially a heart operation. We've made this short video to share with you the experience of one of our patients so that you can understand what to expect.
In this video, we will describe the patient journey from before your heart operation to preparing for going home afterwards. Your journey starts the day you are accepted for a heart operation by the surgeon who will be doing your operation. Your surgeon will take the time to explain the type of operation that you need, and he will also talk to you about any of your existing medical conditions in relation to your general health and your operation. After this, it usually takes around 12 weeks or less to have your operation. This can take a bit longer if you need more tests carried out, but we will always involve you in these discussions and explain what happens if you do need more tests. Once you have seen the surgeon, you will receive an information pack which has all the advice and information you will need to get fit and ready for your operation and to prepare you for coming into hospital. Before your operation, you will get a letter to come into our pre-operative clinic. The clinic allows us to do all the necessary tests to assess your current health and ensures you are fit enough to have your operation. On the day of your clinic appointment, eat and drink as normal and take all of your normal medication. You should bring all of your medication with you in its original packaging. The clinic usually takes around 2 to 3 hours, and we try to do all the tests in the same day, but unfortunately some patients may have to come back another day if tests need to be repeated. We understand this can be inconvenient and we will try to avoid this as much as we can. After you have been to the clinic, we will send you a letter with the date of your admission for your operation. This is usually around 10 days before your operation. At clinic, the nurse practitioner will ask you what medication you take and may advise you when to stop taking certain tablets. We will send a letter that also asks about the medication you take. If you're taking any of the medications listed in the letter, please phone the number given and we will give you advice on when to stop taking the medication before your operation. But please, don't stop taking your medication unless you are given advice on what and when to stop. If you are feeling a bit unwell, are taking antibiotics or have a cold or a cold sore, please call the number on the letter for more advice on what to do next. Before your operation, this is a great time to try to make lifestyle changes that will help you recover better after your operation and help you lead a healthier lifestyle in the long run. Making healthy choices early on mean you will have a more successful recovery after your operation. If you are active normally, keep up your normal routine. If you are well, get out and about. To help you improve your lifestyle and improve your health for your operation, you should think about things like stopping smoking. Your pharmacist or GP can give you advice on stopping smoking. This is important because smokers tend to have more secretions which can lead to chest infections and slow down your recovery. Starting to include walking into your daily routine and start eating more healthily and cut down on the amount of salt in your diet. Losing weight will also help your recovery. Your GP can tell you what your body mass index currently is and what a healthy body mass index should be for you to help to guide you to your target healthy weight. You will receive a cardiac information booklet that will explain your journey and give you good advice to get healthy before your operation and get back to fitness after your operation. Bring this with you when you come in for your operation to help guide you through your recovery. Everyone having a heart operation must have a dental checkup. Even people who have dentures must have their gums checked. This is because infection in your mouth can spread to your heart, so dental hygiene is very important. You should make an appointment with your dentist as soon as you are accepted for surgery. You will receive a dental form from us to take with you for your dentist to sign. Once your dentist has checked your teeth and gums, they will sign the letter to say your mouth is free from infection. You can then post it back to the Jubilee to confirm your mouth is healthy and we can go ahead with your operation. But if your dentist tells you that you need more treatment, let the Jubilee know as soon as you find out and we can advise you on what to do next. This can, unfortunately, delay your operation, but it's important your dental work is carried out first and your mouth is healthy so you can have your heart operation. Most of our patients are planned operations, but sometimes unplanned surgeries take priority over our planned operations. For example, if a donor heart becomes available for a heart transplant patient, This would take priority. If this happens when you are scheduled to have your operation, you may unfortunately have your operation cancelled. We understand this can be disappointing, but we will let you know as soon as possible and keep you up to date with when we can reschedule your operation. If you have any questions about any appointments, you should contact our booking office. The day before your operation, you will be admitted to our cardiac ward on level 3 East. When you are getting ready to come in for your operation, you only need to bring the essentials with you. Please bring good-fitting shoes or slippers for walking with the physiotherapist, a couple of pairs of pyjamas and a dressing gown, and toiletries. When you come to the ward, you will be met by one of our ward nurses who will show you to your room. They will also ask you who you would like us to call after your operation to give an update on how you are doing. Your nurse will give you advice about preparing for your operation, and they can answer any questions you may have. Your nurse will also check who is taking you home and who will help you after you are discharged home, so this is all in place for you. Before your operation, your anaesthetist will come and see you on the ward to talk about your anaesthetic, your existing medical conditions, what medication you take, and if you have any allergies. This information helps your anaesthetist plan the best care for you. Your anaesthetist may also prescribe a sedative to help you sleep the night before your operation. The anaesthetist will also advise you when you should stop eating and drinking before your operation, but your nurse will help you with this if you are unsure. On the day of your operation, your nurse will help you get ready and let you know what time you are expected to go to theatre. You will shower with a special skin wash to prepare for your operation. This can stain your skin pink, but it washes off after a few days. Sometimes the anaesthetist will prescribe a tablet called a pre-med, which will make you feel relaxed and sleepy. Your nurse will give you your pre-med and keep you up to date with what is happening. When it is time for your operation, the theatre porter and the nurse will take you to the anaesthetic room, where the anaesthetist will meet you before the operation. After your operation, you will go into our critical care area, which is also on level 3. Every patient on their operation day has their own nurse looking after them. When you come back to the critical care area, your nurse will call your nominated contact person to give them an update on how you are doing. After your operation, you will still be sleepy from your anaesthetic and be on a breathing machine and have a breathing tube in your lungs. You will also have tubes in your chest to drain any fluid and smaller tubes in your neck to give fluid and drugs through, and your wrist to monitor your blood pressure. It is normal for you to have a catheter in to allow you to go to the toilet and pass urine without having to get out of the bed. All of these tubes and catheters are put in when you are asleep during theatre, and they normally stay in for a few days after your operation. When the nurses and doctors are happy that you are progressing well, they will take you off the breathing machine and take out the breathing tube so you can breathe for yourself and talk. You can slowly start to eat and drink a little while after the breathing tube comes out. Later that day or the following morning, the nurses might get you up to sit in the chair to start your physiotherapy. It is normal to expect some pain after your operation. We want you to be comfortable enough to be able to cough and deep breathe and to get to sit. So if pain is stopping you doing this, tell a nurse who can give you some pain relief. Usually the first or second day after the operation you will go back to Ward 3 East, but usually not to the same room you had before your operation. Here, one nurse looks after 6 patients because most patients are recovering well and need less help. Most of the tubes and catheters you had in will be taken out for you going to the ward or will come out soon. Your physiotherapist will see you and they will let you know if you can start doing more on your own and following your walking route. Practicing your breathing and physiotherapy exercises on your own will help your recovery and get you ready to go home sooner. In the ward, there is a walking route to help to guide you in your recovery goals. Your physiotherapist will explain how much you should expect to achieve for each day of your recovery. Each day, your physiotherapist will visit you and give you daily walking goals and advice on your breathing exercises. Usually by day 3, most patients are working towards their walking goals and can continue on their breathing exercises by themselves. But if you need more chest physio, your physiotherapist will keep seeing you. If your physiotherapist is happy with your walking progress, our physiotherapy assistant practitioners will take you through the last part of your rehabilitation journey to get you ready for going home. If you are walking safely and independently around the ward, the last thing to do is stair practice. By day 4, most patients are ready to continue with their exercises by themselves, and the physiotherapist won't need to see you again. Some patients are ready to go home at this stage. Some patients stay longer, but you might be in hospital for 4 to 7 days after your operation. To get you ready for life at home, the cardiac rehabilitation team will see you in the ward after your operation. They will give you advice for continuing your recovery at home and getting back to fitness and on with your life. All of this advice can be found in your patient booklet containing information and guidance on getting back to normal after your operation. To help prepare you for going home, the cardiac rehab team hold a discharge talk for all patients on a Monday and a Thursday in the ward. The cardiac rehab nurses, dietitians and physiotherapy are there to give you advice on going home and life after heart surgery. This is a good chance for you to ask any questions you might have about life at home. The cardiac rehabilitation nurses will call you a week or so after you get home to follow up on how you are doing, but if you have any questions, you can contact the cardiac rehabilitation nurses at any time. Thank you for taking the time to watch this video. We hope this video helps you to be more prepared for your cardiac journey. We know this can be an overwhelming experience and you may have a lot of questions. We would encourage you to watch this video again and encourage your family and friends to watch with you so they can support you through your journey.